Hello, good morning, and welcome to another video of this course. This is module 3 of Personal Health and Hygiene, and we're going to be looking at mental health and self-care. And under that, we're going to be looking at mental health, causes of poor mental health, introduction to self-care, types of self-care, mental health and society, and how the society can address mental health. So quickly, let us look at what mental health is about. Mental health encompasses emotional, psychological, and social well-being. It affects how individuals think, feel, and act. It is a crucial aspect of overall health, impacting how people manage stress, build relationships, and make decisions. Mental health is not merely the absence of illnesses. It is a continuous spectrum ranging from good to poor, and everyone experiences it differently. So we have the different aspects of mental health, which are emotional well-being, psychological well-being, social well-being, um, and yeah, that's it. Emotional well-being includes feelings like happiness, sadness, anger, and fear, and how individuals express and regulate these emotions. Psychological well-being involves cognitive processes like thinking, learning, and problem solving, as well as self esteem, self efficacy, and a sense of meaning in life. Social well being encompasses interpersonal relationships, social support, and the ability to participate in and contribute to society. What are the causes of poor mental health? Poor mental health can result from a combination of factors, including biological predispositions, traumatic life events, social circumstances, and substance abuse. It can also be due to genetic factors such as family history of mental illness. Additionally, stressful life events like financial problems or loss of a loved one can trigger or exacerbate mental health issues. So let's look at all of this one by one. We have genetics, which is under biological factors. Family history of mental illness can increase the likelihood of developing a mental illness or mental disorder. We also have brain chemistry. Imbalance in neurotransmitters such as serotonin and dopamine can play a role in mood and anxiety disorders. Under physical health, physical health problems can directly and indirectly contribute to mental illnesses. Chronic conditions can lead to physical and emotional distress, impacting sleep, mood, and overall well-being, increasing the risk of depression, anxiety, and other mental health conditions. We also have traumatic brain injuries, also known as TBI. It can significantly impact mental health, leading to a variety of emotional and behavioral changes. And these changes can range from personality alterations and mood swings to anxiety, depression, and even suicidal thoughts. We have environmental factors such as traumatic life events. Experiencing trauma such as abuse, neglect, and violence can increase the risk of developing mental health problems. Stressful life events can significantly impact mental health, potentially leading to or exacerbating anxiety, depression, and other health conditions. Stress can worsen existing problems and increase substance use. We have social isolation. It can impact mental health potentially, leading to increased risk of depression, anxiety, and suicide. When people lack social support and feel alone, it can worsen their mental health. It can increase feelings of sadness, hopelessness, and anxiety. They also have poverty and unemployment. The daily struggles of poverty, such as food insecurity, financial instability, and lack of access to healthcare, can create a constant state of stress, which has a detrimental effect on mental health and well being. Discrimination and inequality can also lead to mental health disorders. Experiencing discrimination, especially when it involves violence or threats, can be a traumatic event that leads to post traumatic stress disorder. We also have psychological factors such as low self esteem. Low self esteem can make individuals feel worthless or overwhelmed, increasing the likelihood of self harming behaviors like cutting and substance abuse. It can also contribute to suicidal thoughts and behaviors. People with low self-esteem may turn to disordered eating as a way to control their bodies and gain a sense of accomplishment, which can lead to eating disorders like anorexia and bulimia. We also have negative thinking patterns. Negative thinking patterns can trigger or worsen anxiety and depression. Negative thinking can increase stress levels, which can have negative impacts on physical health, such as raising blood pressure and weakening the immune system. We also have substance use, alcohol and drug abuse. Substance use can worsen existing mental health problems and make recovery more difficult. Similar drugs can cause depression, anxiety, and paranoia. Cocaine is a type of stimulant that can make previous mental health problems recur and trigger psychosis and schizophrenia. So now let's look at self-care. Self-care is the practice of intentionally engaging in activities that promote physical, mental, and emotional well-being. It's about taking care of yourself and your needs to ensure that you're healthy and functioning at your best. That involves intentional activities and practices we do to take care of our physical, mental, emotional, and social well-being. It is about making choices to nurture and maintain health and happiness. Let's look at the different types of self care that we have. Good self care can take on many forms. It could be in form of getting enough sleep every night, or stepping outside for a few minutes for some fresh air. I can also mean taking time to do the things that we enjoy. So let's look at the different types. We have physical self care. We need to take our bodies if we want them. We need to take care of our bodies if we want them to run efficiently. There's a strong connection between the body and mind. When we care for our bodies, we will think and feel better too. It involves fueling the body, getting enough sleep, doing enough physical activity, and caring for our physical needs. It involves attending healthcare appointments, taking medication as prescribed, and managing the health and, all the parts of the body. Some exercises under this include eating nutritious food, getting enough sleep, and drinking water. We have social self-care. Socialization is the key to self-care, but often it is hard to make time for friends, and it can be easy to neglect our relationships when life gets busy. But close connections are important to our well-being, and the best way to cultivate close connections is to put time and energy into building relationships with others. We also have mental self-care because the way we think and the things that we're feeling in our minds will greatly influence our psychological well-being. Mental self-care includes doing things that keep the mind sharp, like puzzles or learning about a subject that fascinates you, reading a book, watching a movie, or doing things that help you relax and maintain a healthier inner dialogue. We also have emotional self-care. It is important to have healthy coping skills to deal with uncomfortable emotions like anger, anxiety, and sadness. Emotional self-care includes activities that help us acknowledge and express our feelings regularly and safely. And it can be talking to a close friend, talking to your partner about how you feel. So why is self-care important? It's crucial for maintaining overall well-being, including physical, mental, and emotional health. By prioritizing self-care, individuals can manage stress, improve mental health, boost energy levels, and build resilience to better handle life's challenges. And the following reasons are why self-care is important. We have improved health. Engaging in activities like regular exercise, getting enough sleep, and eating nutritious meals can enhance the physical health, boost energy levels, and strengthen the immune system. It can also help us cope with stress and anxiety by providing healthy ways to manage difficult emotions. It also causes enhanced well-being. By prioritizing your needs, you can improve your overall sense of well-being and happiness. Practicing self-care can reduce stress, anxiety, and symptoms of depression. Another importance is better mental health. Self-care can help us improve mental health and reduce the risk of mental health conditions like depression and anxiety, and also for improved productivity. When you prioritize your well-being, you're able to focus and be productive in all areas of your life. Taking care of yourself allows you to recharge and rejuvenate. leading to increased productivity. You also have increased self-esteem and self-worth. Personal care practices can boost self-esteem and self-worth. By prioritizing your needs and engaging in activities that make you feel good, you send a message to yourself that you deserve care and attention. Another importance is prevention of burnout. Regular self-care can help prevent burnout, which is a state of physical, mental, and emotional exhaustion caused by prolonged stress. By taking proactive steps to care for yourself, you can replenish your energy and prevent the negative consequences of a burnout. Let's look at mental health and the society. Mental health is not just a personal matter, it is a community issue. A society influences mental health through culture, beliefs, and social norms, community support systems, access to healthcare, laws, and public policies. Mental health determines how people function in families, schools, workplaces, and communities. When society supports mental well-being, people are more productive, creative, and peaceful. So let us look at the individual impact. Mental health impacts an individual's ability to cope with stress, learn effectively, work well, and contribute to their community. Poor mental health can lead to difficulty in relationships, including social isolation, which can be particularly harmful for children and adolescents. Mental health problems can put a significant financial and emotional burden on families, including financial costs for treatment and the individual struggle of family members. Stigma and prejudice surrounding mental health can lead to discrimination and social isolation, further further impacting individuals' well-being. We also have societal impacts, which are economic burden. Unaddressed mental health problems can result in significant economic consequences, including reduced productivity, increased healthcare costs, and the loss of income due to unemployment. Mental health issues can contribute to societal problems like homelessness, poverty, and incarceration. Mental health is a public issue, and addressing it can improve overall social well-being. Factors like poverty, violence, and social isolation can increase the risk of mental health conditions. Improved mental health can lead to stronger communities, increased social cohesion, and greater civic engagement. How can the society address mental health? By policy programs, implementing policies and programs that promote mental health and well-being and reducing stigma and discrimination are crucial for addressing mental health at a societal level. Also, providing community-based mental health services and support can make it easier for individuals to access care and reduce the stigma associated with mental health. Advocacy and awareness. Raising awareness about mental health and dispelling stigmas can encourage individuals to seek help and create a more supportive environment. Fostering strong social connections and support networks can improve mental health and well-being. Thank you for watching this video. We have come to the end. In the next video, we'll be learning about skincare hygiene and oral hygiene. Bye for now.